My name is Phil Robinson, Executive Director, Corporate Services at the Women's and Children's Health Network and proud sponsor of our collaborative work with the Friends of the Women's and Children's Hospital. I'm deeply honoured to be the one to say a warm thank you to the Friends of the WCH and their incredible generosity and unwavering support to the Women's and Children's Health Network in enhancing our healthcare services. In the 2022-23 financial year, our community has donated an astonishing $542,348 worth of equipment to our medical facilities. It is important to note that some of these items were carried over from previous years due to delivery timeframes, underscoring the dedication of our supporters. The equipment donated this year encompasses a wide range of medical devices that will significantly impact the care we provide to our patients. These invaluable contributions include a cardiograph machine. This cutting-edge machine will enable us to monitor fetal heart rate and contractions during pregnancy and labour, ensuring the safety and well-being of both mothers and babies. Bladder scanners for paediatric medicine. These scanners are essential for accurate diagnosis and treatment of paediatric patients, minimising discomfort and improving their overall healthcare experience. Hybrid incubator for nurseries. A neonatal care unit will now benefit from this advanced incubator, providing optimal conditions for premature infants to thrive. Ventilator for NICU, our neonatal intensive care unit. This life-saving equipment will support our tiniest patients in their battle for health, offering precise respiratory care for newborns. Argon beam coagulator for theatres. Surgeons will have access to state-of-the-art technology to perform precise, efficient and safe coagulation during surgical procedures, ultimately benefiting all of our patients. In addition to these remarkable contributions, I would like to extend a special mention to the Queen Victoria Auxiliary, whose dedicated efforts have made a substantial impact. They have donated $23,454, which has been instrumental in acquiring 2 cuddle cots. These cots will provide much needed comfort to grieving parents by allowing them more time to say goodbye to their precious infants. A treatment chair for women's outpatients. This chair will enhance the comfort and well-being of the women receiving outpatient treatment, ensuring their experiences are stress-free as possible. Support for the Memory Box program. The Queen Victoria Auxiliary has also extended their support to the Memory Box program, which aids families coping with the loss of a child by providing keepsakes to cherish their memories. Please know your support exemplifies the power of collective compassion and selflessness. In the following moments, you'll hear from staff who will elaborate further on some of these items donated, shedding light on how they support patient care. Once again, I extend my heartfelt gratitude to all Friends of WCH members for their generosity and commitment to our shared mission of improving healthcare for our consumers, carers and their families. Your contributions are not just investments in equipment, they are investments in the well-being, comfort and future of every consumer who walks through our doors seeking care. Thank you, and let us continue our journey of making a positive difference in the lives of those we serve. Together we can achieve remarkable things.
Hi, my name's Madeline Goff. I'm a clinical nurse educator here on Cassia Ward at the Women's and Children's Hospital. From the Friends, we received a bladder scanner. A bladder scanner is a device that we use to locate the bladder, and from there we can determine if it's empty or full. We were lucky enough to trial the bladder scanner before we got to buy it, which means we could pick one that suited our staff and our consumers better. Bladder scanners are notoriously hard to come by, and obtaining them after hours is nearly impossible. Having one on the ward means that we have ease of access, and it means that we can provide intervention and treatment in a timely manner. We're lucky enough to share this bladder scanner with all of the medical wards, so the benefit reaches a large variety of consumers. We would like to say thank you to all of the Friends members and let them know that the contributions you make here make a real difference.
Hi, I'm Professor Alison Kent, the Head of the Department of Neonatology at the Women's and Children's I am one of the neonatologists working with an amazing dedicated team of medical, nursing and allied health staff looking after preterm and critically ill babies at the Women's and Children's Hospital. The Friends of Women's and Children's have generously donated 3 vital pieces of equipment for the neonatal unit. The first is the Thankyou ventilator, which is a specialised ventilator that has been designed specifically for our tiniest babies. It allows us to be able to support the ventilation of these babies non-invasively, which helps us reduce the amount of lung injury that these babies might suffer while they're in the intensive care unit. The second piece of equipment is the GE Giraffe Omnibed. This incubator allows us to care for the tiniest preterm babies, providing warmth and humidification in the first weeks of life. The third piece of equipment is the GE Shuttle. This will allow us to move the Giraffe Omnibed into the operating suite and into the delivery rooms so that we can care for our tiniest preterm babies with a mobile intensive care unit. This will then allow the babies to be in their one incubator from the minute that they're born until the time that they arrive into the neonatal unit and stay in that incubator for the first 1 to 2 weeks. We would like to extend a big thank you to the Friends of Women's and Children's for all of their dedication and commitment to raising funds which help us support the care that we provide our tiniest and sickest babies. The entire team in the neonatal unit would thank you from the bottom of our hearts for everything that you do that allows us to provide the best care that we can for these babies and their families.
Hi, I'm Ange Potter. I'm the Senior Physio at the Women's and Children's Hospital, and the Friends donation has given us the money to purchase a new cough machine. We call it the cough machine, but actually its technical name is an insufflator-exsufflator machine, and we use it for kids who've got muscle weakness, so things like muscular dystrophy, spinal muscular atrophy, and for those kids who don't have a very strong cough, if they get a really bad chest infection, they can suffer with having retained mucus in their lungs, and it really affects them. It might mean that they need to come into the hospital to use the cough machine, and we use it to, as I say, clear mucus out. So I'd like to give my really heartfelt thanks to all the members of the Friends from around South Australia. You do an amazing job, and thanks so much for raising this money to help us purchase this new piece of equipment. I really, really appreciate it.